Well, she held the job for just hours before Dr. Joan Duwve changed her mind and told Governor DeWine she was not coming home to run the Ohio Department of Health. A stunning turn of events the governor likely was not expecting. But the question tonight, why did this happen? Let's bring in senior health correspondent Monica Robbins for some perspective here. Hi, Monica.
Hey, Laura. In a statement to the State, a Columbia, South Carolina newspaper, Dr. Joan Duwve says the last 24 hours have been very difficult for her and for her family. She goes on to say, in part, quote, "I was informed that the former director's family had faced harassment from the public. While I have dedicated my life to improving public health, my first commitment is to my family. I am a public figure. My family is off limits." Dr. Duwve also stepped down from her position as the South Carolina Public Health Director. It's not an easy job anywhere. According to a study by Kaiser Health News and the Associated Press, as of last month, 49 state and local public health leaders have resigned, retired, or been fired since April across 23 states. Now, you'll all remember Dr. Amy Acton. She was the first woman appointed to run ODH, and while many credit her for saving thousands of lives, others vilified her for ruining the state's economy. Her decisions launched lawsuits from businesses. Her politics riled Republicans. Protesters, some of them armed, demonstrated outside her home, and the state legislature voted to limit her powers. She was also the target of anti-Semitic attacks for her faith and attacks on her gender. So whomever takes this job is going to face critics as long as this pandemic is raging, and the health and safety of the public may require government intervention. But for now, Laura, the search continues.
That's right. It'll be interesting to see what the governor says when he takes the podium once again on Tuesday. Monica, thank you.